What is internal brace? So friends, internal brace is a major breakthrough in the field of sports medicine surgery since the last 30 years. After the invention of internal brace, the athletes, the professional players, and the people who are just recreational sports persons or just going to the office jobs are resuming their job at a much quicker speed. And the athletes are getting back into the sports after the surgery within 3 months. So friends, whenever we are doing a ligament or tendon reconstruction or a repair, in the conventional method, because there is no security to the repair, the rehabilitation period is very slow. The patient cannot weight bear from the next day of surgery. He cannot bend their knees or bend their ankle or shoulder from the next day. So the rehabilitation process is very slow and the complete recovery comes in around 6 months. So with the internal brace, the recovery period has drastically shortened. So after the internal brace, the athlete can weight bear or bend their knees or move their shoulder from the next day of surgery. Why? Because internal brace protects your new ligament. It acts as a seat belt to your new ligament. So friends, there are a few things you need to remember, that internal brace is not a synthetic ligament. The ligament or tendon is from your own body. Either we are repairing the ligament or we are making a new ligament through ligament reconstruction from your own body tendons. They are known as ligament reconstruction. But we are protecting the new reconstruct or the repaired ligament or tendon with the fiber tape internal bracing. So basically it acts as a seat belt to the new ligament and it protects the post-operative laxity, loosening and stretching of the ligament, and it allows the immediate weight bearing and immediate mobilization of the joint after the surgery. That's why the recovery period has drastically shortened and the player gets back into the sports within 3 months. So friends, don't confuse it with the synthetic ligament. It is your own natural ligament which is being repaired or made. Internal brace is just to protect it during the recovery phase of your ligament surgery so that it heals well, doesn't get stretched, doesn't get loose, and you get back into the sports quickly. In our next video, we are going to tell about how the internal brace really works. Friends, if you like our video, then do like it and put some comments and do subscribe the channel. If you have any doubt about your MRI report, whether it is of knee, shoulder or ankle, then do send us your MRI report and I will personally go through your report and read it in detail, and we will reply with the appropriate and the perfect solution for your injury.